Hello, and welcome to the Pharmacy App Review by Brian Sanchez, Luis Marquez, Andrea Rhodes, and Emily Johnson. We are going to briefly describe our top 2 paid pharmacy apps, Lexicomp and Micromedics, and top 2 free pharmacy apps, Hippocrates and Medscape. At the end, we will briefly mention our favorite specialty apps. We have also provided a pros and cons table to download and review.
The first free app we are reviewing is Hippocrates. One of the benefits of Hippocrates is that most of the main functions are free to use. No subscription is necessary for the drug reference, interactions, pill ID, guidelines, calculators, or tables. Unfortunately, some of the other parts of the app that could prove useful carry a $175 a year subscription. Those items have a lock icon in the upper right-hand corner. I find this app fairly user-friendly and easy to navigate. The drug reference is set up by system/condition, but you can also search by drug name. I find the separations and categories easy to find what I'm looking for. As you search for drugs, you can add them to the interaction checker with the drug reference by tapping the exclamation point icon. Hippocrates also has a good pill identifier that works both off and online, but unfortunately the pictures of the pills are not available offline. The tables are available offline and provide good algorithms and summaries of a variety of scenarios, for example, ACLS algorithms or controlled substance schedules. Overall, I think Hippocrates is a good free app to access. Hippocrates updates their information and clinical content weekly, but that does require a manual update of your app through the App Store. It is available on both Apple and Android devices. You do need to be logged into the app before you can go offline. Other downsides are lack of patient education and counseling information, and there is no insurance information included.
Medscape is a free app that is available on Google Play and the Apple App Store. It organizes drugs alphabetically, and you can search for any drug in the database by generic or brand name. It stores your recently viewed searches for quick reference. It also includes guidelines, procedures, study tools, articles, PubMed abstracts, and continuing education. You can search all the services at once by clicking Search Medscape at the top of the screen. The conditions section has useful information like clinical presentation, differentials, diagnostics, treatment, and medications. You can tab back and forth between adult, pediatric, and geriatric drug information on the same screen. It includes dosing forms and strengths, as well as dosages, route, and frequency for both FDA and off-label indications. Many of these features, including all the drug and dosing information, are accessible without internet or cell service. It includes common herbals, over-the-counter meds, and some supplements, all which can be added to the interaction checker. It also includes combination drugs like over-the-counter cough and cold medicine. The app has 125 clinical calculators, including basics like dosage by weight, creatinine clearance, IV drip rate, BMI, and CDC growth charts. It doesn't have the most calculators of the apps we reviewed, but it is searchable. It lets you check the retail price of a medication at pharmacies up to 50 miles away from any city or zip code. It can also tell you in the formulary section whether a drug is covered by a specific insurance plan, in what tier, and whether it will require a prior auth. You must add insurance plans manually to your list the first time you use it, but it lets you add plans from multiple states. Some of the improvements that could be made include making the pricing, pill identifier, and study tools available offline, and updating the pregnancy and lactation information to reflect the 2015 FDA rules. Overall, Medscape is a user-friendly app with lots of helpful features.
Next app we're going to review is the Lexicomp app, which is an app we're pretty familiar with because of our pharmacology class. It's the same thing except for the app version. It's a pretty expensive option, however. It's $29.99 a month through the App Store, or you can get a yearly subscription, which is $174 on up, depending on the features you want included. One of the biggest advantages is that you can download the whole library, but it takes up about a gigabyte of space, so you have to have some space available on your phone. The app is also pretty intuitive. Right here we're going to click on the library, and here you see the Lexi drugs at the top. Another section that I really like is the infectious disease section. You can go through disease syndromes and look at different diseases, and it'll give you a summary, it'll give you likely pathogens, and drug treatment therapy overview. Another section that this app has that a lot don't have is the pharmacogenomics section, which helps guide you with genes and treatments depending on genomics. There's also a adult patient education section and a pregnancy and lactation section, which are really useful, and pediatric section. Also has a drug ID and interactions. The drug ID takes up almost 250 megabytes by itself, so it's a pretty big one, but it has pictures and stuff. Also has about every calculator you could think of to do drug calculations. Also has an IV compatibility section, which would be really nice in a hospital setting. So basically, it's a really comprehensive app. It has just about everything that you could think of in the app. It's just really expensive, although I have heard that there's a way to download it for free if you're a health science center employee. But if you're interested, you can look into that.
Hi, I'm going to talk to you about IBM Micromedics. It's one of the top 5 apps, telephone apps for pharmacology. I like it because it's very easy to use on the phone. It has all the medications in alphabetical order, and you can actually print or search for a drug using the drug or classification. I'm going to look at acyclovir, and the drug IBM Micromedics gives you adult dosing, so you can go from adult dosing, and you can do go back to pediatric dosing just with a touch of your fingers, and it gives you contraindications, drug interactions, adverse reactions, and clinical teaching. I like this app because it gives you things that you can teach your patients on the medication, on acyclovir. You have also adverse effects and contraindications. The only thing that Micromedics, and it's only $2, less than $3 a year for this app. The only setback I see is that you have to add and pay more for your poison index and your neofax, and also your drug ID and IV compatibility. Other than that, it's pretty good. Thank you.
While we do not have the time to review these in detail, we encourage you to download and view these specialty apps. For pregnancy and postpartum, we recommend the paid Mommy Meds or Infant Risk Center apps. For lactation, we recommend the free LactMed app created by the NIH. For natural or herbal remedies, Natural Medicine's Comprehensive Database is a good subscription-based app. For STD treatment and contraception, we recommend the free CDC apps. The CDC also has free apps for vaccine schedules and opioid guidelines. For antimicrobial therapy, Sanford is the go-to resource, although this requires a subscription. And lastly, good old UpToDate. Unfortunately, this requires a subscription as well. Thanks for listening.